Xylitol's role in evidence-based dentistry. We've come full circle. We're back to this slide again, but now we're going to put it all together and also talk about some other areas that the challenges you face in your practice. The role in preventative dentistry. John Peldiak, Journal of Dental Hygiene. New parents who use xylitol are less likely to transmit the strep mutans infection to their children. This slide represents percent colonization of mothers who use fluoride, chlorhexidine, or xylitol. All we're looking at here is the amount of children that were colonized with the strep mutans bacteria with the moms using the particular protocols below. You'll see that moms that use fluoride, 50% of their children were colonized or infected with the strep mutans bacteria, whereas the chlorhexidine group was about 26 to 27%, but down here on the low side, moms who use xylitol gum, xylitol sweeteners, only 7% of the children were infected. Now, when mothers use xylitol, the children have fewer cavities, as shown by this slide. It depicts where the moms began using xylitol chewing gum at the time the baby was born, and they used it for a period of 2 years. When the children were 2 years old, they came in and they did DMF scores, and you can see that at that time, the xylitol kids had 0 cavities, the chlorhexidine kids had less than half a cavity, and the moms that were using fluoride, or the fluoride kids, had about half a cavity. We project that out to 5 years or 3 years later, you notice that the fluoride kids, where the moms were using fluoride, they had a little over 3.5 cavities, where the chlorhexidine kids had just under 3. But again, on the low side, xylitol comes in again with less than 1 cavity per child at age 5. It's important to understand in this slide that the children never used these products. They didn't start chewing the gum. This was just moms using it from the period 0 to 2 years. So they were not passing that bacteria on to their child. And this might be a good point to interject the eruption period infectivity concern. Anytime you're going through an eruption period, it's a higher risk time for passing the bacteria on to the child. Because as the teeth come in, the gums tend to swell and they get red and swollen, and those bacteria have an easier time to become involved in the oral flora of the mouth. Also, the decay rates can be higher at those times because the tooth hasn't calcified completely. When should you start this prevention plan? After the child is born, or even 6 weeks before the child is born, the moms and the dads should start chewing the gum. It's found that the infection is more vertical in family lines than it is horizontal. It's very difficult to get an infection or to be infected from a neighbor or another child, unless of course it's in a daycare center where you can exchange that bacteria on a regular daily basis. It takes more than just one inoculation or one touching to be able to pass these bacteria on. When should xylitol be used? The eruption of teeth are considered an at-risk period, and we just discussed that. I just talked about that a little bit before. Period of infection for strep mutans. We believe this is a very important time to have xylitol program in effect, not only for immediate protection, but also for the long-term residual effects of xylitol. Xylitol infant and toddler tooth drops. There are several of these out on the market, and it's important that you use these for your younger patients, and also can be used for geriatric patients because sometimes it's very difficult for them to brush. They also don't like to chew gum and mints, but this does allow them a way to get the xylitol into the mouth. The other important part about infant drops is that ones that are on the market contain both xylitol and calcium glycerol phosphate, so it acts as a buffering agent to help remineralize the teeth at the same time you're increasing saliva and removing bacteria. They should be used for 6 months of age until the child can chew gum responsibly, and we usually, from an age standpoint, that's 3 to 4 years old, but we leave that up to the parent to decide. They know whether the child is swallowing the gum or if they're dropping it on the carpet. allows xylitol coverage during the eruption phase of the primary teeth. This early intervention should significantly reduce the risk of caries disease process and eliminate the number of cavities even further. Why does it work? Xylitol affects the ecology of dental plaque and thereby reduces the rate of dental caries. It also increases the amount of saliva. The saliva helps carry the bacteria out when they become slicky instead of sticky, and also adjust the oral pH. How does it work? Uptake of xylitol by strep mutans sets up the futile cycle, leading to depressed cell growth or even cell death. What kind of xylitol? 100% xylitol sweetened products, gum, mints, yielded the best results in reducing plaque and the strep mutans in young patients wearing fixed orthodontic appliances. Xylitol enhances fluoride treatments. The most impressive results have been achieved when a xylitol program has been added to existing prevention efforts. We're not asking you to reinvent the wheel. Whatever program you're using is a good program. Add xylitol to your program and you'll notice impressive results. Dry mouth is always a problem, becoming more and more of a problem. There are many prescription drugs that cause dry mouth. Dry mouth is extremely uncomfortable for the patient. Lack of saliva leads to increased caries, particularly root caries, and it's very difficult for them to eat. They don't have enough saliva to swallow the food. A dry mouth solution, xylitol is an excellent salivary stimulant. Stimulated saliva is less acidic, so you're going to raise the pH in the mouth, except in the case of radiation, and we discussed that earlier in the presentation. As needed, use xylitol products such as gels, sprays, mouthwashes, toothpaste, mints with calcium in some form, calcium lactate, calcium gluconate. And xylitol can be added to the water or tea or coffee. Xylitol's role in oral disinfection. Again, bacterial regrowth slide, it's important that you remember this. It does not do any good to just put them on a regimen using an antimicrobial. It will not be effective in the long run.